First we'll see external features of nose. See here, this is the root of the nose. This is root of the nose. This is apex of the nose. This is the dorsum of nose. Okay, and it is having the base having the nostrils. So this is apex or tip of the nose, and this is the base having the nostrils, the openings of anterior nasal apertures. Then here it is root. This is the dorsum. Okay, and on either side you can see the cartilaginous part and its smooth part. These are ala of the nose. These are ala of the nose. And here, this is the base, no? At the base, two nostrils are there. Two nostrils are separated by one septum. That is nasal septum. Actually, the lower part of the nasal septum, and it is covered by skin, what we are calling columella. Okay. Then below that columella here, this part is there, no? In between the columella and the upper lip. That means red line. This area what we are calling philtrum. This is philtrum of upper lip. Okay. So these are the external features. And here we have to discuss what are the structures which forms the roof of the nasal cavity, and what are the structures which forms the floor of the nasal cavity, what are the structures which form the lateral wall, and what are the structures which forms the medial wall or nasal septum. Right? Here we have to discuss in detail about the nasal septum and lateral wall of nose. These are very important questions. First, if you take the roof, here this is the roof. This is the roof of the nasal cavity. Roof of the nasal cavity is formed by here nasal bone. This bone what we are calling nasal bone. This is the nasal bone, and this is the nasal spine of frontal bone. This is frontal bone, and it is having the projection. So nasal spine of frontal bone. Then here it is broken actually, but here cribriform plate of ethmoid. And here sphenoid bone. These are the bones which are forming the roof. Of course, in the anterior most part, there will be cartilage also. Here cartilage, nasal bone, nasal spine of frontal bone, cribriform plate of ethmoid, sphenoid. These are the structures which forms the roof. Clear? Then this is floor. Floor is formed by palate. See here, this is hard palate. We know this. This is hard palate. This is only forming the floor. See here, this is a nasal cavity. This is roof. This is roof. This is only floor. So this is the floor. So this floor is formed by palate. How the palate will form? Actually, this is hard palate, and posteriorly soft palate will be there. This hard palate is formed by here two processes are coming to form the palate. These processes are belong to maxilla, and they forms the palate. So palatine process of maxilla. Two palatine process of maxilla, and here two horizontal plates, but they belongs to palatine bone only. Horizontal plates of palatine bone. See here, these are palatine process of maxilla. They are fusing here and forming one suture in the center. And here two horizontal plates of palatine bone. They are fusing in the center. And here horizontal plate of the palatine bone and the palatine process of maxilla. They are fusing here. So that totally it becomes the cruciate suture. It is like a cross, no? It is like cross. So this suture what we are calling cruciate suture. So what I am trying to say, this palate is forming the floor for the nasal cavity. Is it? Now you know what is roof, what is floor, right? Then what is medial wall? See here, this is the septum. This is the septum which is separating the two nasal cavities. Right and left nasal cavities are separated by nasal septum. Right? So this nasal septum, how it is formed? See here, I have removed this mucous membrane. Then I can see here, these are the bones and cartilages which are forming the nasal septum. Two bones, one cartilage. These things you have to remember very carefully. That three you have to write. Remaining structures, if you can tell, that's well and good. If you don't tell also, it's not that much worried. But three structures you have to write. One is coming down from the ethmoid. So perpendicular plate of ethmoid and vomer. Perpendicular plate of ethmoid and vomer. These are the two bones and one cartilage. That is septal cartilage. structures which forms the nasal septum. Perpendicular plate of ethmoid, vomer, and septal cartilage. Still, if you wanted to tell nasal bone, nasal spine of frontal bone, sphenoid bone, that means small contribution it is giving, sphenoid bone. Then here 3 crests. One is incisive crest, crest of maxilla, crest of palatine bone. Crest means the small projections they are coming up. Nasal septum is formed by perpendicular plate of ethmoid, vomer, septal cartilage. Along with that, nasal bone, nasal spine of frontal bone, sphenoid bone, crest of palatine bone, crest of maxilla, and incisive crest. This is lined by mucous membrane that we will write. After that, what is blood supply? What is nerve supply? For our convenience, we can divide this into 4 quadrants: antero-superior quadrant, posterior-superior quadrant, antero-inferior quadrant, posterior-inferior quadrant. Right? So, like this we have divided. If you divide like this, anterior part supplied by anterior ethmoidal. Here, posterior ethmoidal. Then, along with that, sphenopalatine. Anterior ethmoidal, posterior ethmoidal, sphenopalatine. Then, posteriorly and below, greater palatine. Anteriorly and below, facial, superior labial artery, branch from the facial. So, means superior labial artery, it is a branch from the facial artery. So, totally how many became? Anterior ethmoidal, posterior ethmoidal, sphenopalatine, 3. Greater palatine, superior labial, total 5. Branches of these arteries at the antero-inferior part of the nasal septum, they are anastomose. There will be anastomosis of all these arteries at the antero-inferior part of the nasal septum. That area where all these arteries are anastomosed, that area what we are calling Little's area. That arterial plexus are the anastomosis of all these arteries. That plexus what we are calling Tisselbach plexus. So here Tisselbach plexus. That area is Little's area. That plexus what we are calling Tisselbach plexus. If there is any heart or vasodilatation which leads to bleeding from this plexus. So bleeding from the nose what we are calling epistaxis. Epistaxis is nothing but bleeding from the nose. Right? So this is blood supply. Then nerve supply. Anterior ethmoidal nerve, nasopalatine nerve, and there is a nasal branches which are arising from the ganglion which is present in the pterygopalatine fossa. So pterygopalatine ganglion. From the pterygopalatine ganglion, there is a nasal branch enters into the nose. Then it will be divided into 2 branches. One is medial branch, another is lateral branch. Medial branch will supply to the nasal septum, lateral branch will supply to the lateral wall of the nose. So how can we say this? Nerve supply to the upper part, posterior part, and medial wall, and it is a nasal branch. So posterior, superior, medial, nasal nerve or nasal branch. Correct? Posterior, superior, medial, nasal branches. Right? Posterior part, anterior ethmoidal nerve. Then here, below and posterior. Here in this area, greater palatine nerve. Then anterior part and below. What is that? Anterior superior alveolar. Of course, anterior superior alveolar is branch from the infraorbital nerve. Infraorbital nerve is continuation of maxilla. So, what is the nerve supplying here? Anterior superior alveolar. Anterior superior alveolar. Okay. So, these are the nerve. Okay, I will repeat it. Anterior and superior quadrant, anterior ethmoidal. Posterior and superior quadrant supplied by posterior, superior, medial, nasal branch from the pterygopalatine ganglion. Posterior and inferior quadrant supplied by greater palatine nerve. Anterior and inferior quadrant supplied by anterior superior alveolar nerve. So this is nerve supply. Okay. If you wanted to say the applied aspects, because of any infection or chronic cold which leads to septal deviation, septum will be deviated towards one side which leads to obstruction on another side. In the nasal septum, what we have discussed, how it has formed, what are the different blood vessels which are supplying to the nasal septum, what are the different nerves which are supplying to the nasal septum. Clear? So this is nasal septum finished. Now we will discuss about lateral wall of nose. This is lateral wall of nose. Here also same. First we have to see what are the bones which forms the lateral wall. And what are the different features which are present in the lateral wall of nose? Blood supply, nerve supply. That we have to discuss. First, if you take lateral wall of nose, from anterior to posterior side, some bones will be forming the lateral wall of nose. Okay, that I cannot show you because I have to remove all these things. But remember one by one. From anterior to posterior side, nasal bone. Then here there will be one process which is extending up from the maxilla to attach to the or to articulate with the frontal bone. So frontal process of maxilla. Then lacrimal bone. Don't confuse. Nasal bone, frontal process of maxilla, lacrimal bone, then ethmoid bone. Labyrinthine of ethmoid. That labyrinthine of ethmoid will form the superior and middle concha. Superior concha and middle concha. Then after labyrinthine, there will be one plate descending down from the palate, perpendicular plate of palatine bone. Perpendicular plate of palatine bone. Then medial pterygoid plate. Medial pterygoid plate. Along with these bones, there will be one separate bone which forms the inferior concha. That name itself inferior concha. Okay? Inferior concha. Recollect. Nasal bone, frontal process of maxilla, lacrimal bone, labyrinthine of ethmoid forms the superior and middle concha, and inferior concha. It is separate bone. Then perpendicular plate of palatine bone, medial pterygoid plate. So these are the bones which forms the lateral wall of nose. Then what are the different features? See here, self-like projections. See, this is one self-like projection, this is one self-like projection, this is another self-like projection. These self-like projections from the lateral wall, there will be projecting in towards the nasal cavity. That means if it is a lateral wall, from here there will be self-like projections are there. These self-like projections what we are calling concha. What are these? Concha. These concha are 3 in number. Superior concha, middle concha, inferior concha. You can see here. Superior concha, middle concha and inferior concha. Right? So, if you reflect the concha or if you remove the concha, there is a space below this concha. Those spaces what we are calling meatus. What are the meatus? So, if you remove the superior concha, this is superior meatus. If you remove the middle concha, below it middle meatus. If you remove the inferior concha, below it inferior meatus. Inferior concha, inferior meatus. Middle concha, middle meatus. Superior concha, superior meatus. Right? Now we'll see what are the features of inferior meatus. Here, yeah, very good. See here, I am reflecting the inferior concha. If I reflect the inferior concha, we can see the inferior meatus. So this is inferior meatus. Into the inferior meatus, only one feature we have to remember, that is nasolacrimal duct. Nasolacrimal duct will be opening into the inferior meatus. Okay. Let me show that. At the probe point here, you can see.
Lift it up once.
This is the opening of nasolacrimal. Opening of nasolacrimal. Okay. Of course, it will be guarded by valve of Hessner. So, this is the nasolacrimal duct opening. Right. So that's what. Whenever you are crying through the nasolacrimal duct, lacrimal fluid will be entering into the nasal cavity. You must be aware of it. When you are crying, tears will be entering into the nasal cavity and you will be removing and you will be wiping to the front. Is it? So that means there is a communication from the conjunctival sac to the nasal cavity through the nasolacrimal duct. That is about the inferior meatus. Then you will see middle meatus. This is the middle concha. I am reflecting this middle concha. As soon as if you remove or if you reflect the middle concha, here you can see the bulging. Is it alright? Bulging is visible. This bulging, what we are calling bulla ethmoidalis. What is this? Bulla ethmoidalis or ethmoidal bulla. Ethmoidal bulla, bulla ethmoidalis. Below this bulla ethmoidalis, you can see the semilunar or half moon shaped hiatus. Is it alright? This is hiatus semilunaris. This is hiatus semilunaris. This hiatus semilunaris is half moon shaped. Right? And if you see anterior to the hiatus semilunaris, there will be infundibulum. That infundibulum will be connected with frontal air sinus. See, this is the frontal air sinus here. This is frontal bone. Within the frontal bone, there will be frontal air sinus. Frontal air sinus connected with the infundibulum by a duct. That duct, what we are calling frontonasal duct. Frontonasal duct. Indirectly, what I am telling? Frontal air sinus opening into the middle meatus. That means hiatus semilunaris. Frontal air sinus opening into the hiatus semilunaris through the frontonasal duct. That is one opening. Then behind the opening of frontonasal duct, there will be opening of anterior ethmoidal air sinus. Here, anterior ethmoidal air sinus opens. Right? Then there is one more. There is maxillary air sinus. Opening of maxillary air sinus. Then over the bulla ethmoidalis. Over the bulla ethmoidalis, here middle ethmoidal air sinus is open. That means how many openings are there? 4 openings. Frontal air sinus opening through the frontonasal duct into the infundibulum of hiatus semilunaris. Then anterior ethmoidal air sinus, maxillary air sinus, middle ethmoidal air sinus. And then we ask, what is bulla ethmoidalis? Bulla ethmoidalis is a projection into the lateral wall of nose. It is because of middle ethmoidal air sinus. How it has formed? It is because of middle ethmoidal air sinus. Middle ethmoidal air sinus will be projecting into the lateral wall. So that forms the bulla ethmoidalis. Okay. So over the bulla ethmoidalis, middle ethmoidal air sinus opening will be there. So that is about bulla ethmoidalis, hiatus semilunaris, and the openings of different air sinuses into the middle meatus. That is about middle meatus. Any difficulty? So here, what are the terminology you have to remember is frontal air sinus, frontonasal duct, infundibulum, bulla ethmoidalis, hiatus semilunaris, anterior ethmoidal air sinus, middle ethmoidal air sinus, maxillary air sinus. Okay. If you remember these words, you can easily form the sentence. Right? That is about middle meatus. Then if you see superior meatus, actually this is superior concha. We have removed this superior concha. If you remove this, here actually this very small portion is there. But imagine this is the superior meatus. In the posterior most part of the superior meatus, here you can see the depression. Here it is, depression is there. This depression, it is in relation with the sphenoid bone and ethmoid bone. So what we can call this? Sphenoethmoidal recess. So this recess, what we are calling? Sphenoethmoidal recess. Into the sphenoethmoidal recess, there will be opening of sphenoidal air sinus. Into the sphenoethmoidal recess, opening of sphenoidal air sinus. Okay. Then along with that, what is the air sinus which is remaining now? Everything over one section. Very good. Posterior ethmoidal air sinus also opening into the superior meatus. So these are the different features which are present in the lateral wall of nose. Now we will discuss about the blood supply of lateral wall of nose. Any difficulty in the features of lateral wall? Okay. Then we are dividing like this, 4 quadrants. So in the anterior and superior part, anterior ethmoidal and posterior ethmoidal arteries. Okay. Posterior and superior part, sphenopalatine artery. Posterior and inferior part, greater palatine artery. Then anterior and inferior part, supplied by facial artery. But what is that branch? It's a branch from the facial, but what is that branch? Alar branch of lateral nasal branch of facial artery. Alar branch of lateral nasal branch of facial artery. Okay, so that is the blood supply. Then nerve supply. Nerve supply is also almost same. Of course, this middle part, upper part, it will be supplied by olfactory valves. That means this is olfactory region. It is taking the sensation by olfactory receptors. Okay, because it is for the smell sensation. Then anterior and superior part, anterior ethmoidal nerve, and posterior and superior part. Here you have to tell me. There is a nasal branch. It is dividing into medial branch and lateral branch. One is supplying to the nasal septum, another is supplying to the lateral one. So posterior, superior, lateral nasal. Posterior, superior, lateral nasal. Okay. Then posterior and inferior part, what will be there? There will be, actually it's a greater palatine nerve, but some books they give anterior palatine nerve. Anterior palatine nerve. Anything is okay. Greater palatine or anterior palatine. Then anterior and inferior part supplied by, yes, same, anterior superior alveolar. It's a branch from the infraorbital nerve. Infraorbital nerve is branch from or continuation of maxillary. Okay. So this is the nostril.